something that is very, very close. I mean, it's something similar to what you attended earlier as well, but this is something that is very close to my heart, and I'm really, really passionate about, talking about, techniques, or you may say interventions that really helps children, because my expertise are in child psychopathology and child intervention. So this is something that I really believe in, and I've seen a lot of results because of interventions that involve play altogether. So yes, before we begin, I think I would like to ask you people that what exactly is your view about trauma? So what is your understanding? What exactly is trauma?
Trauma can be a distressing moment for anyone. Like it's not necessary कि वो बहुत कोई triggering event हो या फिर कोई ऐसा incident हो. वो बिल्कुल भी कोई छोटा सा event भी हो सकता है और वो बिल्कुल कोई बहुत बड़ा event भी हो सकता है. ये depend करता है कि how you perceive the situation, how distressing it is for you. मतलब हर किसी के लिए वो situation different होती
Absolutely, absolutely. It's a very personalized experience. It's something that really, really is a very subjective experience, you may call it. That, you can't really have a very definite definition of trauma altogether. Something that is traumatic for one person might not be traumatic for another person. And when it comes to childhood trauma, what do you think? What are the things that might affect a child's ability to cope, socially, emotionally, or what would be perceived by a child as traumatic? What do you think comes under this category?
है. Maybe an accident or death of a loved one.
Of course,
The
yes,
experience
absolutely.
of the experience of death चाहे वो फैमिली में किसी की भी हो मतलब फर्स्ट एक्सपीरियंस वो
Mhm.
एक trauma.
Absolutely right. You're absolutely right on that. Well, it can be anything, to be honest. This is one example that Zainab has just given, that it could be that, when and children, it's difficult for children to actually process the experience of death, because they're looking for answers, and out of curiosity, they're looking for answers, and they're not getting any definite answers, which sometimes lead to not giving them the closure that is required, and that might have a lingering effect on them. Sometimes children do tend to outgrow out of that particular phase, but some children, when they lose a parent, or they lose a very, very dear one who they were really close to, it is difficult for them to process that. I'll give you an example of this, that how exactly this particular thing might affect a child. I came across this one particular incident where a child was really affected because the mother was having a terminal illness, and then she passed away, and she was like, the child was prepared, and the family was preparing the child, but since the mother was a single parent and dealing with the child, uh, so so yeah, this was very disturbing for the child altogether. Initially, he was fine, but later on, there weren't very any clear signs and symptoms that the family could see, and they would intervene altogether. They saw that probably the child saw the mother having that terminal illness, so he might have accepted that over the period of time. However, trauma had an effect. It was a traumatic experience for him, and it had a delayed, you would say, onset of symptoms. And in the onset of symptoms, the very clear manifestation was in terms of his behavioral symptoms. And the behavioral symptoms included a lot of agitation, disturbances, meltdowns, frequent agitation, refusing to do certain stuff, and being very rigid about his demands. And then later on, they started noticing that there was this one particular symptom that was referring to his, he basically trying to go in retrospect and reverse the time, because he couldn't really explain. He was 6 years old. He couldn't really explain that, what exactly is he going through. But he was really affected by his mother's death, and of course, it was very disturbing for the child. And all he was trying, how the family was able to make sense of it, was because whenever he would ask for something, and the family would say that, okay, if he's asking for a chocolate and they don't have a chocolate, and they'll say, okay, probably we'll go and buy a chocolate and then give it to them. So they are fulfilling the demand, but the child would want to reverse back time. He would say that, okay, go back to the clock, reverse time, go, I asked for a chocolate at 6 o'clock, so reverse time, put the clock in the same order at 6 o'clock, and now give me that chocolate. All he was trying to do, and all his behavior was reflecting, or it was a manifestation of him trying to tell that how he wants time to be, to reverse back. because he was disturbed by that thing. He wanted to reverse and change everything. So childhood trauma can have a very, very, a long lasting effect on, and I'm going to give you a lot of examples. I'm so sorry, I'm giving that disclaimer right away, but I'm giving you, if you feel uncomfortable at any point, you are more than happy to leave, during the workshop. But yes, we are going to talk about something that requires a lot of courage, and sometimes it's very disturbing to hear when children go through these experiences. But this is for real. Children go through these experiences, and like, Zainab gave that example, that death of a loved one or death of anybody sometimes, you might even say that, if a child has come across any sort of violence, if a child has come across any sort of such circumstances which weren't very pleasant, and the child has been a victim or a witness of that, so that might also be called as a traumatic experience for the child. So that this can come from, anything, and things like, or emotional, physical or emotional abuse, you may say, neglect of any sort, witnessing violence, or even losing a caregiver, like we just mentioned. So children may not always, have words. Just like I gave you this example, they might not even have words to describe their experiences. But trauma can affect, their mental health in a lot of different ways in terms of their behavior. So behaviorally, we have to observe a lot of things when it comes to children. That are there any signs that are referring that the child is affected by that one particular incident, or even, sometimes in terms of their physical health as well. I remember that I came across, somebody told me that all of a sudden there was a change in the child's behavior, and she would just close her fists and keep them closed all the time. She would, and the fist would have nothing. I mean, in the closed fist she would have nothing. And when it was probed in, it was probably identified that something happened in the school, probably a nanny or anybody else who was involved. Something happened in the school that led to this particular behavior. So that was a fearful response. So she was trying to, remain composed by keeping her fists closed. So there are going to be behavioral signs. You can't necessarily say that the child will be able to speak with words, even if they have words, but you are going to see clear signs. And sometimes there can be that they have regressed back to an earlier level. And I remember I had a client who said that, who was a, she faced a long-term neglect, and the parents started noticing that when she started bedwetting at the age of 11, and she continued doing that till the age of 17, which was one of the signs. She couldn't really, nothing could help her. She was perfectly toilet trained, but then again, regressing back was a sign that there's something wrong with the child. And it was observed that, it was because she was bullied by her own brother, and also at the same time there was severe neglect from the parents, so different departments had to actually intervene to save the child. So trauma, yes, can be in different forms. Physical, it could be in the form of, you can say, in the form of abuse, in the form of neglect, in the form of, uh, they could be they could be witness of violence. So there could be a lot of examples, but yes, a personalized experience, subjective experience. So we can't really come up with a definite definition of it, but something that the child finds overwhelming and is unable to cope with would be categorized into a traumatic experience altogether. So how exactly can we recognize, signs of trauma in children? So, some of the very obvious ones are the behavioral changes. There's going to be aggression, there's going to be withdrawal, there's going to be acting out behavior, and these are the common ones that you're going to see. But there are also going to be emotional responses like anxiety and depression. So the fearful response of closing her fists comes under the category of anxiety. In terms of depression, they might be crying spells, they would be very edgy, they would cry and cry, have frequent meltdowns. So that is also one of the signs that, the child is affected by something that is currently not available in the environment, but in retrospect there's something that has happened and we need to investigate that. In terms of physical symptoms, yes, frequent disturbances, sleep regression, sleep disturbances, psychosomatic complaints, having a stomach ache, frequently reporting or throwing up. These are also signs, because in children sometimes these psychosomatic symptoms are signs of anxiety in them. So they might report that. They might just, refusal to eat anything and be very edgy around that thing. That is also something that can be considered as an important sign. academic and social difficulties, there might be a very withdrawn behavior, very isolated behavior. They might refusal to go to school, because in the child, who was closing her fist, she was continuously refusing to go to school and would be very fearful. And, her apparently her behavior would tell that, there's something that she's trying to avoid whenever we're talking about school. And she would seek reassurances that, the parents will not send her to school, or they will change her school. So there are these signs that are there, and should not, as parents or as caregivers or as therapists, we should not ignore that if the parents are mentioning that. So these are going to be some of the signs. And also, it's a regression to an earlier stage of skills. The skills were mastered earlier, but then again, there is regression. Then this is also an important sign that, for example, the child has just, he was perfectly brushing his teeth, but all of a sudden he's just doesn't know how to go about it, and he's just clueless and blank about it. Or like I gave an example of toilet training, the child was perfectly toilet trained, but at the age of 11, when you don't expect that, you see a child bedwetting. So they're going to be, some signs that are going to be there. And we can't really solely categorize, for example, bedwetting or child not being able to brush their teeth into one particular category, that the child is affected by trauma. Rather, we have to see the full profile, that the child was perfectly fine earlier, and all of a sudden, abruptly, there are certain things that, in days we weren't expecting that, but one incident happened, and after that, there has been changes in the child's behavior. That is when we would call that, it is the effect of the trauma. That is why the child is having all these, behavioral changes. So when it comes to therapists, how exactly, when it comes to therapists, how exactly, I know that, you're well aware about what exactly trauma-informed care is, and what are the, core principles of it that we have to keep in mind as therapists. However, I would want to know your opinion when it comes to safety. What do you think that, when it comes to children, how can you ensure safety, trustworthiness, choice, or collaboration? Because that is going to be something that will be very, very important for you to move forward and, begin the healing experience. If the child is not going to be engaged, is not going to find the environment to be safe, then likelihood of the intervention being very successful with the child, or it being a healing process, would be very low. And so what do you think? I would like to know your opinion, that what exactly is your definition of safety in a therapeutic setting?
My definition is that you give the child um, some options. Let's say if they're not willing to open up, then you provide perhaps different solutions, such as if they don't feel like communicating, then maybe you can wait for a while and ask them maybe to write down their thoughts and not expect them to or force them to open up.
Yes, of course, you're absolutely right. But Natalia, when it comes to, for example, it's my first session. You're absolutely right that we're going to give them choices, we're going to give them control, in order to ensure safety. And we're not going to jump onto something that is triggering for them or that is uncomfortable for them. That is absolutely right. I would agree to that. But at the same time, with choice, it is also that we have to understand if the child is ready. If you think, like you said, that provide them with different means and opportunities where they can express themselves. So for example, if you are not getting if the child is not expressing through words, maybe redirecting their attention using using a sandbox technique, or a play based method, providing them with different toys related to the context. And even if you feel that the child is being triggered or is trying to avoid that, maybe distracting them with certain different, you don't have to get that info, don't target that, in the session you will be targeting to get information, or to find information and investigate. You don't have to be an investigator, rather you have to be you have to act as if you're trying to develop a bond with the child first, because the child's trust has been affected in some way when it comes to trauma. So that trust needs to be built, and that therapeutic alliance is very, very important. So first few sessions will just focus on building that bond. When the child starts trusting you, then move on to targeted things that would provide you with certain information, so that would help you investigate further or probe it into further. If you're going to start with the first session with a lot of, even if you have a lot of means and a lot of different targeted activities, the child likelihood of the child withdrawing from those activities is greater. So you might just withdraw that, okay, this person knows something about this thing, and that is why they've provided me with these toys, that are making me feel overwhelmed about it. So yeah, but you're absolutely right. Choices are very, very important. A lot of different means, indirect means of gathering information is also very important. Zainab, you raised your hand.
Ma'am, I think you have explained what are for women.
Okay, amazing, amazing. Thank you. Okay, so in trauma for informed care, it basically means that you have to understand that trauma is widespread and you have to use that guide in order to help children and in order to interact with children. So when it comes to trauma informed therapy, we're basically going to prioritize safety, we're going to prioritize trustworthiness, empowerment, we're going to give them a lot of choices, and also collaboration is very important. And in terms of collaboration, it's not a collaboration or the therapeutic alliance between you and your client, but it's also referring to the collaboration with the parents and caregivers would equally involve. If one person is in, if they come to your setting and they feel safe and they have that trust built up, but then when they move out of that setting, they don't feel that they're safe, then that means that they won't be able to generalize the skills that they're going to learn in your therapeutic setting. So in order to do that, it's very important that you involve parents and caregivers into the therapeutic process and educate them and let them know that what exactly are the things that they need to do and what exactly are the things that they need to avoid. Sometimes parents do not realize, but they keep on asking the child, for their own, just so that they can fill in the blanks that are there, in their mind. But they don't realize that that can be very, very overwhelming for a client who's already disturbed. So we need to make certain boundaries very clear, that while the child is in the therapeutic process, there are certain things that the parents need to take care of. For example, not pushing the child. For example, if the child is avoiding a particular setting, I remember there was a client who got really, really, she was, I think, 4 years old, and she went to a mall and she got really scared because it was an automatic flush in the washroom. And she got just so scared of that she would avoid going to washroom in any space. And mother would use diapers for her because, she couldn't really help it. And the child would refuse. She would cry and cry and would not enter the washroom at all. So sometimes parents are also in a very challenging situation in these incidents, but even if they're trying something new, I remember the same parent mentioned to me that they had to visit some guests and they were trying to push the child there, that go and use the washroom and everything is going to be fine. They thought that this is going to be an opportunity for the child to learn and she will get over it, but no, for that particular child, it's a very, very, that overwhelming feeling. It comes out of the fear that she experienced at that given moment. So that is in a lot of high intensity, and that's not going to go away, with one particular incident. It might work for adults, but sometimes it doesn't work for children as young as 4 years or 5 years because they can't really understand that. They're going to build the association between safety and that incident has been disturbed, and it's going to take some time for you to develop that. And you have to take a very gradual and a slow approach in that. So the parent was very disturbed, and they came to me, and of course, we did try intervention, but we exposed the child very slowly and gradually, and she came over and she got over with the fear that developed. Parents also took her to a mall, and in a safe setting, and she was able to use that, and it took some time, but the parents were later able to realize that they pushing and telling the child that nothing is going to happen, she's going to be completely fine, wasn't working at all, because the child built her own association based on her age group. There are certain things that sometimes when it comes to anxiety, deep breathing, these are the common things that we use in order to help the child relax and calm down. And when it comes to practices, for example, a trauma based practice for children where you want to teach them relaxation, it's not going to be something that is going to be a huge practice that we do with adults. I mean, it's going to be a lot different in that aspect. And let's just try one of the activities, I believe. I am going to try that with you. But some of the ideas that have been mentioned, as therapists, you can use that with children, that involves breathing buddies. For example, it's very difficult to, I mean, educate sometimes children as young as 4 years, 5 years, 6 years. It's difficult for them to even do deep breathing in the manner that you want to do them. And just to make it as a fun activity, maybe ask them to pair it with a stuffed toy or put a cushion on their tummy and ask them to, okay, now just observe the movement. So as you inhale, you're going to see that squeezing inside your stomach, and as you exhale, you're going to squeeze, you're going to see that coming out. So just observe that movement, and with that you build that concentration and joint attention, where the child is going to do deep breathing with in a very I mean, in a very with a lot of attention, given to the whole process. Sometimes you can use bubble blowing for that, for for very young children, candle blowing for very young children. So you can do a lot of different methods, but if you want to, you trying to make a child learn relaxation with the intention of mindfulness, then probably using a stuffed, this particular breathing buddies technique is very, very helpful. Then color me calm. In that, we use specific colors with children, like, colors such as, I mean, there are research based colors based on a lot of research that has been done on art therapy. And that is that, colors like green, purple, or light blue, they're those calming colors that have a very calming effect on your mind. There are a few others as well, but, you specifically using those particular colors. And you can say that probably you can put a lot of paint on a particular tray, and you can ask the child to dip their hands and their feet in that particular, I mean, you do it in a sequence, that you do the hands first and then you do the foot, your feet later, that you ask them to actually dip that inside, and then probably have printed on a blank white sheet. Now that particular activity, it has been proven through research that it has a very calming effect. This particular activity where you're involving the child's, it's a sensory based activity where you're involving the child's hands and feet, dipping them into a particular color, and then having that print onto white paper. That's a very calming technique for children, and that really, really helps calm the nerves. So if a child comes with a lot of anxiety or behavioral symptoms like acting out, teach the parents about these activities, that their muscles or their senses need to calm down at that given moment. So if a child goes into a fight or flight response, they need to calm down, and in order to engage them to calm down, the usual methods of calming down, like giving them water, or making them sit down, for adults that might work, but when it comes to children, we have to use certain activities where yes, they're calming down, but also it's a play fun-filled method that they're really enjoying as well, and they're very engaged in as well. Then water-based activities are also very helpful. You can probably help them see and visualize different colors, and that is also something that really, really helps them calm down, because they're very focused in those particular activities. Then the worry box. So just like the worry box, you can also have the gratitude box as well, but it's just that they're externalizing and letting go of the worries that they're having. So you can use this particular. Is anybody familiar with worry time?
Yes, ma'am. This is the basically the technique in which we set a time for worry कि पूरा दिन में हमने सिर्फ इस वक्त इस बारे में सोचना है और बाकी दिन हमने अगर थॉट्स आएंगे भी तो हमने उनको इग्नोर करनी है। Am I right?
Yes, you're absolutely right. Absolutely right. It's the same way we do it with children. Sometimes, even with adults, what we do is that, we usually, the usual practice is that we would tell them that, okay, so, you have to assign yourself a time, and in that particular time, you can journal, I mean, this is a designated time when you're going to worry, deliberately worry, right? The basic intention is to avoid the client, to help the client avoid worries, because they're going to use a delaying tactic. Whenever during the day they're going to be worried, they're going to assign that, or delay it, or postpone it to a time that has been designated for their worry time, right? So when it comes to children, we use a physical box. And the reason we use that physical box is to avoid, to help the child reduce the amount of overthinking or being overwhelmed because of those intrusive thoughts that they experience at that given moment. So, what you do is you ask the child to have a simple, it could be a shoe box or a decorated box that they can use, or even sometimes a virtual box can also be there that can be placed on the desktop if you're doing that in terms of teletherapy, right? So, you can ask the child to decorate it. So, this is going to be a worry box, and, make it very personalized so that the child starts to own it up. And then you ask the child to think of something that is worrying them or making them anxious. And it could be something that is as simple as worrying, about a test at school, a fight with a friend, or anything, right? Ask the child to write it down or draw that worry. Right. So they can even draw a bubble and just, scribble something inside it in the form of a color, or they can actually write the thought if they want to. Once they're done doing that, for younger children, you may say that, okay, you can simply verbalize it and we're just going to color that. So the worry has gone into this particular sheet, and then we're going to fold it, and then we're going to place it inside that particular box. So that means that the child is not engaging with that intrusive thought. Once they're not engaging, that means they're not having that diffusing experience with their senses, because this is the likelihood why they feel overwhelmed, because they think of something that makes them recall of that particular event, and then their senses fuse with that particular thought, and as a result you see the child feeling either going into the fight mode, flight mode, or just completely freezing. So, in order to avoid that, we're going to externalize and rather let the client, rather than engaging with the thought, we will let the client, externalize and put that worry inside that box. And it's going to be a physical thing that would give closure to that particular intrusive thought. So, they can have as many worries as they want. And this is also going to provide the child a solution to dealing with this intrusive thoughts, that, okay, when these intrusive thoughts, they're like bugs or errors, we don't really have to engage with them if I don't have an answer to it. So I'm going to, write it down, I'm going to scribble it, and I'm going to put it in my worry box. But that is something, that is there, and the worry box is going to take care of it. So that is something that you can use, and that is something that is very, very helpful with a lot of different children. They really enjoy doing that. Other than that, there is another activity that is called the superpower shield. And the basic purpose of this activity is to empower children to manage their emotions. It's also a fun and a very empowering way to help children feel strong and in control of their emotions. Basically, it allows them to imagine that they have a shield that can protect them from negative emotions, stress, and fears. So, basically, the basic purpose of this particular technique is to encourage resilience and also help children build a very strong inner sense of inner strength. How exactly this particular activity works? So, all you have to do is explain the child that they have a special superpower shield that can protect them from anything that makes them feel scared, sad, worried, fearful. And that shield is basically what represents their inner strength. And it also makes them feel a lot more powerful when you try to explain that, because children really are really inspired by superheroes, and they feel that, that's their inner strength, that shield is there. So it's not, they start sometimes visualizing it. And then ask the child to actually draw or describe their shield in as much detail as they as it is possible, or as much as they want. You can provide them with a blank sheet of paper. You can ask them to draw it, or in terms of virtual settings, you can provide them with a whiteboard and ask them to draw it. What exactly your sheet looks like? What color is it? And ask them a lot of questions about it, right? So that, they're actually able to visualize it, that, this is actually a shield that is there. So once the child is able to describe their shield, and then ask the child that, okay, where exactly is the activation button? So where are you going to activate it from? And the child is going to, of course, they're going to create an activating button. Okay, so this is how you're going to activate it. And then ask the child that, once you've activated that, just imagine that, that particular shield is now surrounding them. So in cases where you feel that and say that when exactly would you want to activate this particular shield or turn it on, what are the incidents, and you might get a lot of helpful information there, that the child might say, okay, I want to turn that shield on when I'm feeling anxious. Some children are really really scared of, like, there's certain pets, and they might say that I want to turn the shield on, and the shield is going to be on around me, surrounding me, when a particular when there is a dog or when there is a lion. And then you can ask that, okay, how exactly is that shield going to protect you? What are those, what is exactly is this shield built up of? So you can engage the child in a lot of different ways. It's basically, you know telling the child that building or helping the child regain that confidence in their inner strength, which they've lost because of that one particular incident that happened. So it's important that with that imaginary shield, or that sometimes children actually cut out that paper and say that I want to keep it with myself, and they feel a lot secure, because they feel that this particular shield is my inner strength, and I that is going to provide me with all the courage and the confidence to deal with any sort of adversity that I'm going to go through. So this particular association sometimes is very very beneficial in the therapeutic settings when you're working with young kids. When it comes to older kids, it's very important to actually sometimes I personally always do that I explain them the compassionate mind model. And this was something that I was introduced by one of my mentors, and it is such a beautiful model where you explain the child that how different layers or different compartments of your brain are basically dealing with different things. For example, one particular layer is dealing with the day-to-day stress, the second is dealing with how competitive you are, what you're achieving, what you're not achieving, and then the third one is basically the shield, the compassionate, the superpower that we say, that who is basically providing with all the strength. So every person goes through adversity or any sort of stress in life, but it is that third power that is there, which basically calms you down, just like a mother calms the child down. So for older kids, like adolescents, you can explain the model to them in a way that they feel that we probably need to invest a lot of things. My superpower is lacking a lot of skills, and I need to recharge it, I need to provide it. And even with younger kids, you can tell them that the shield is going to be recharged if you do this number of times you do deep breathing, this number of times you do this particular exercise, so your shield will be recharged automatically. And they might just practice doing that throughout the day, just so that the shield is recharged, and automatically you're achieving what you want to achieve out of it. And then comes the balloon release. So visualizing, stress relief and letting go. It can be done in any you can ask them to blow a balloon and just release it. And you can say that, okay, when you blow the balloon, that means you're putting all your stress and stressful thoughts into the balloon. And then when you're releasing it, oh, did you see? And they find it as a very fun experience, that okay, so my stress is releasing everywhere. But at the same time, you can say that how exactly can they let go of that feeling of overwhelm that they're experiencing. Okay, so how about we try the breathing buddies at the moment? If you've got a stuffed toy or a cushion or anything, squishy, or you may say soft, or even a pillow would work. If you can place it on your tummy. So I said that can you get something soft? Yes, it can be a cushion, it can be a pillow, it can be your favorite stuffed toy. If you could just quickly grab that so that we can do breathing buddies together. Okay, so what you have to do is you have to place that, whether it's a pillow, whether it's a cushion, you have to place it on your tummy. Sit straight with your back straight, and then place it on your tummy. If you don't have anything, just place your hand on your tummy and consider that as your buddy. In order to begin the exercise, what you have to do is you have to take a nice deep breath. You have to inhale it through your nose as if you're smelling a flower, and then slowly breathe it out through your mouth as if you're blowing a candle. Let's do it one more time. Just give me a thumbs up once you're done. Okay? So we're breathing through our nose as if we're smelling a flower. Keep it, keep it in, and now blowing it out as if you're blowing a candle. Whatever you placed on your tummy, whether it was your hand, it was a cushion, it was a pillow, did you observe it rising and falling with each breath? So, this is something that we can do in order to not just engage our client, but also to help them observe that how to keep them mindful in the process as well and keep them very focused. So, it's not just going to be restricted to one breath or two breath, there are going to be multiple others. But say that, you're doing it with your, ask the child to label that particular thing. It can be a favorite stuffed toy as well, that, that's their buddy, and the buddy is going to support them through the breathing process. Children usually find that as very engaging and very fun activity, and they would engage in deep breathing. I mean, you can say that, whenever you're feeling overwhelmed, whenever you feel you're anxious, or you want and you can't really make sense of that feeling, because sometimes children would say that मेरी तबीयत खराब हो जाती है, or I don't know what happens to me. So in those cases, you can just say that, whenever you feel, sometimes our mind needs that clarity. And in order to get that clarity, you can always practice this. That is something that they find helpful in most situations. Now, when it comes to activities, there's also one important thing, because a lot of things happen, and I also take sessions through teletherapy. I take sessions with young children, I take sessions with adolescents, young adults. One thing that is common and one thing that I always do is personalizing the approach and also adapting it for the teletherapeutic settings. So, adaptation is very important. How you're going to conduct an activity in the in-person setting is going to be different. Your child or your it might be easier, but when it comes to teletherapy settings, some people find it easier, but some people find it difficult. But what you have to do is look for all the digital tools that are available in order for you to have a successful, in order for you to be able to successfully implementing the technique that you want to apply or implement. If you don't have the successful tools, I would say that wait. Do not rush into it with the useful things that are there and then, asking other people, because then it's not going to serve you any benefit. So use, digital tools like virtual whiteboards, drawing apps. Now there's so many different adapted models after COVID that are available that you can use for therapeutic purposes. But these are some of the models, and you can also design your own activities like a PowerPoint where you can design that activity and make it engaging in the form of a slideshow. That is also something that children really find engaging. Encourage participation and involvement in an online setting. And for encouragement, you can say like, using thumbs up, using stickers, I mean, different models of reinforcement that are there, so that, you keep the child engaged and interested in the whole process. Personalize the approach. For example, if your child doesn't like certain characters, or it's, he's got specific interests in certain cartoons, this is the first thing that you want to know, and you should know about, and you should inquire about, and use that as much as you can. Maybe have a background so that, they feel really safe, that the therapist is also taking into consideration what exactly are the things that they like, and that actually helps in terms of the therapeutic alliance. Engage parents and caregivers as well. So there might be certain games that you want to play, for example, any sort of a memory game related to emotions that you want to play with the client. You may also send materials, therapeutic materials, to parents as well, and just ask them to set it up for the client, and then you can use that. But yes, you can ask the parents and caregivers and train them on certain techniques that you think the child is able to master and is has mastered already. Some of the key takeaways from our today's session. Yes, how does trauma? We have basically touched upon the idea that how exactly trauma affects children in multiple ways. Um, But how exactly, our therapeutic activities or different things that we do to adapt in terms of providing them with a trauma-informed care is very helpful. Providing them with fun activities make therapy more engaging and accessible. Teletherapy, yes, is a powerful tool, but at the same time, it should be conducted in a safe, supportive manner. And also, empowering children and families to heal together is most important. It's not just the child who's affected. Sometimes there are certain incidents where parents are also equally affected, so it's very important to consider that, and help them accordingly as well, because sometimes their behavior also tends to have an effect, or their anxiety or their depression also tends to have an equal effect on your client. All right, and that's it.